2-year-old who reportedly, quote-unquote, bit into an electrical cord. She is awake and crying with no respiratory distress.
All right, you have your scenario. Let's go ahead and get started. Grab your cheat sheet, Broslo tape, whatever you've got. But if you're using Broslo or Hand-Tevi, remember, red goes to the head and head to the heel. You can see that she falls into the yellow zone. And now to Scott for your quick tip.
So little kids bite into electrical cords. And why do little kids bite into electrical cords is simply because they're little kids. So when you have these children who hit the door who come in with a burn right here in the corner of their lip, that's classically because they bit into a cord. And recommendations in the back of the reg or the ER is, as long as they look cute, chances are they're probably going to stay cute. And before we send them home, we get a 12 lead just to make sure that everything indeed is okay. But happily, the majority of them do just fine. Now, as you can imagine, watching for airway is very appropriate. But what's absolutely crucial for mom and dad to know is if this kid is not going to be admitted for other reasons, that about a week or so later is when they can bleed. And what happens is right here in the corner of your lip, there's an artery that goes right by the corner of your lip. And as the scar tissue starts to break down and reform itself, they can spontaneously start to bleed. We don't admit them for a week because that would not be cost effective, and in our lifetime, that's just not going to happen. But all we tell parents is if they decide to bleed, just like with basic Stop the Bleed campaign, direct pressure is where it's at. So if they decide to bleed, reminding parents to just simply put some gauze with some pressure on it until the bleeding stops. And if it doesn't stop, certainly coming in to the ER is appropriate. But the majority of them are going to do fine. The majority of them do not bleed. But when you're going to send these kids home, making sure, just like with tonsils, that mom and dad know that about a week or so after is when there's a possibility of bleeding. Making sure that they're aware of this is absolutely crucial.